welcome. And today I'm super excited to welcome Justin Bates as our guest, where we are going to talk about the future of pharmacy, especially with the Canadian and the Ontario landscape in mind. Justin brings an immense experience with him when it comes to advocacy for pharmacy, because he has been a pharmacy advocate for about the last 15 years, previously serving as the CEO of the Neighbourhood Pharmacy Association of Canada, and now he is the present CEO of the Ontario Pharmacists Association. Thank you very much, Justin, for taking your time and coming on the show. I am so grateful, and it's an honor to have you.
Listen, I'm so excited to be here. I think having a conversation about the future of pharmacy is what energizes me, and certainly it's timely given where we are in the pandemic and what's transpired over the last 18 months. So happy to jump right into it, and let's unpack what we can do as a pharmacy profession.
For sure. And as I said, I think, you have definitely been an inspiring leader. And I'm just very honored that I have this opportunity to, have this discussion with you, because I think your insights are truly valuable, especially with the amount of advocacy that you had to do on the go, is what I'm going to say, during the pandemic. I would love to hear, some of your insights, and especially some highlights or achievements from the pandemic for our profession and pharmacy professionals in general.
It's a great starting point, because one of the things that I think we've learned is not just resiliency, but agility and the ability to adapt throughout the pandemic, because there was no playbook. There is nothing off the shelf that we could take and say, this is how you manage through a pandemic. And undoubtedly, mistakes were made, and learnings from there were applied to hopefully improve the way that we're delivering healthcare in general. I think if anything out of the pandemic we can take from, it's the silver lining that there are gaps. We probably have discovered more fault lines during the pandemic than any time previously, when you look at our public system of delivering healthcare, and certainly with long-term care and the unfortunate circumstances that many residents and their families found themselves in. And it's certainly appropriate as we look at primary care, public health, and pharmacy. And I would say, we've had lots of successes. As a profession, we've had an opportunity to really demonstrate and showcase what it is that pharmacy professionals do every day. That common, sometimes misperception that we're only about counting pills or dispensing has been, I think, debunked by the high accessibility and the value that people have placed on being able to go to what is really a healthcare hub in the community to access credible and trusted healthcare information. So while we'll continue to be a core anchor of our services in the medication management space, we have expanded out the relationships to show that we can do a lot more. And whether it was things like COVID testing, or looking at how we can help patients manage all of the information that's being thrown at them. And we know that science communications was maybe one of the biggest hurdles we had. Information that wasn't always clearly defined or communicated confused people. And the first place they turned, and I actually remember hearing so many stories from our members about this, that the press conference would still be on the air and live, and pharmacies would get calls almost in real time based on a government announcement. And we had to adapt so quickly, because oftentimes our members were learning about new changes in policy, requirements, and guidelines as it was happening. And that made it very difficult and challenging. But I'm very proud of how pharmacy professionals stepped up to meet the challenge and really help protect public health with solutions, whether it was the vaccinations or looking at even moving things virtual, like MedCheck. We've looked at our model and we've said, this is where it's going and where we need to be. And we're going to use this as an opportunity to certainly expand our services and show government and the public why it's so important that we continue to build capacity in our healthcare system. We're not going to solve this overnight. We know that fiscally it's challenging, healthcare sustainability, making sure there's enough hospital beds, that there's a safe environment within long-term care and access to GPs. The pharmacy is part of that solution. And what we have been able to do, and we've tested this out, measured it through public opinion polling, is we're now at the dinner table conversations. People are talking about the conversation that they had with their pharmacist. the information that may have made them from one point being vaccine hesitant to getting a vaccine. And that to me is the grassroots support that will translate into future success, whether it's through advocacy and government relations, public relations, but also to boost the morale of the profession.
I agree. And you said that it was what you said about the whole dinner table conversation. I truly agree with it. I think there was no guessing that at one point we were the only healthcare providers that were open for business and that were actually available for our patients when they needed it, when they needed us. And that has truly changed the perception. And, I think there's also research that highlights how we need to change our perception from just being the pill pushers, or how we're commonly known as, to a lot more that we are able to provide for our patients, right? Especially during this pandemic, we have taken on a lot of expanded scope of practices just to kind of help support their healthcare needs. In the post-pandemic world, what do you see taking place in terms of changes for the scope of practice of a pharmacist and a pharmacy technician?
I think we really need to look at and examine what is the gaps, or what are the gaps in the healthcare system. And I see really two primary gaps. The first is in routine immunizations. So what we've experienced, if you look at the data, the gap between those who used to get there or should be getting their routine immunizations and are is somewhere in the 30 to 40% range, depending on the data set. And that could be our next crisis. We saw it a few years ago in BC with outbreaks. I think it was the measles or the mumps that was a public health crisis pre-pandemic. And with all of the emphasis on, and rightly so, the COVID vaccines and testings, we may have a slippage there in terms of people getting their tetanus shot, as one example. So I do see a role for all healthcare providers, but certainly pharmacy professionals, and that includes technicians and pharmacists, to be able to be part of all publicly funded immunizations. And I think that will be critical to addressing that gap and closing it. But also, it's all about convenience and access. Sure, we need to do this in a cost-effective framework and get fair reimbursement and reasonable reimbursement. But at the end of the day, we have to have a solution to the problem. And public health, we've demonstrated our ability to certainly improve the vaccination rates, increase them. And I think that's in large part because of our expertise, the trusted relationship we have with patients, and our high accessibility. So I'd put routine immunizations right up there, and it's part of our proposal for the fall hopeful regulatory package in Ontario. The other one is certainly longstanding. It's been over a decade of asks by the Ontario Pharmacists Association, and it's really catching Ontario up with the other provinces. And that is treating and assessing minor ailments. And where we are coming at this from is not to take away or to compete with another healthcare provider, but it's that crucial component of creating capacity. You're not going to eliminate the need for hospital beds or access to a general practitioner. But what we can do is take some of the low acuity cases that can be served in the community by tapping into and leveraging the expertise, education, and knowledge of pharmacists. And that's going to be obviously more convenient for families, because we have 95% of Ontarians live within 5 kilometers of a pharmacy. So if you think about that, just from managing your own health, if it's pink eye or uncomplicated urinary tract infection, these are, in some cases, can be painful, but there are both over-the-counter remedies as well as prescriptions that could help. Or even as a triage service, we look at that as perhaps the first point of care, if you will, first contact, where a pharmacist may refer them to a specialist, or suggest they go home and get rest, to even more severe cases that they need to go right into the emergency department. So I think that's invaluable as we look at trying to distill down to what is the community pharmacy of the future. And we're close. I think we're probably, I'm very confident that we're getting close to the finish line in Ontario, not only for the scope piece on the regulatory front, but also for fair and reasonable reimbursement that we've proposed. So those would be our two, I would say, primary asks. There's lots more. Certainly point of care testing opens up a myriad of opportunities for the profession in early diagnosis. I think of all kinds of areas we could expand on that front. And I think COVID testing is sort of the door opener. But it doesn't end there. If you think about flu testing, certainly strep throat, rapid HIV testing, so many areas we could help serve the population that would help reduce healthcare costs and increase the convenience factor.
For sure. And I mean, I agree with you. Like, I think the testing piece definitely was a kind of a shocker in the way of how rapidly our profession adopted it. Even though, initially there was a little bit of a push and pull, but over time, we are seeing a major success with it. So, congratulations on that. And I think it definitely opens up a lot more doors. And I think if we are talking of minor ailments, to a point, I would also see testing kind of go hand in hand as a package. For example, like strep throat, you would want to test somebody before you start to prescribe somebody. And rapid kits are becoming available, where you're able to get results in a few minutes, which makes it a lot more easier when you're trying to make a decision of, how you want to proceed further with your care plan with this patient, right? What I was going to ask was, so the minor ailments, I'm seeing all these CE announcements being made and all of that. So how soon can we expect some sort of an announcement, or is that something still in the works?
Well, certainly being cognizant of past optimism around the program being implemented, I would say I'm cautiously optimistic that we'll have the announcements in place and all of the frameworks that need to be enabled in order for us to implement by the fall. So there is positive dialogue going on, collaborative dialogue with a variety of different departments within government, both on the senior officials within the bureaucracy as well as politically. So I think there certainly is widespread support for all allied health professions getting expanded scope and practicing to the maximum amount of their expertise. And I think we've seen the Minister of Health comment directly on common ailments in Ontario. So there's lots of encouraging signs. We've put together a very comprehensive proposal with the funding of $20 per assessment. And I want to emphasize that because our approach is slightly different than other provinces. So we've got the college who has put forward a proposal of 12 common ailments or minor ailments. We would have loved to have seen that expanded to where some of the other provinces are, but I think it's a good start. And we want to get compensated based on that time and the counseling and interaction with the patient, regardless of the outcome. And as I mentioned earlier, the outcome could be as simple as you're okay, go home, or it could be here's an OTC product for you, an over-the-counter product, or it could be a prescription. In many of the provinces, they're paid only on the outcome of a prescription. And I think that is a miss. So we want to make sure that that assessment gets a $20 fee. We've estimated the time to be anywhere from 15 to 20 minutes as an average of the interaction, and that's how we came up with the fee structure. And we think it's fair and reasonable return because ultimately the savings are going to be generated by avoiding a higher cost visit to the healthcare system, be it through an emergency department or hospital admission or as at a GP level. So, but I also think it's very important that we position this correctly and communicate it. This is not about competing for dollars or patients with other healthcare providers. It really should be increasing the interprofessional collaboration, better health, better outcomes. The doctor's chair is not going to go absent. People will always be present there, but it's about the right person at the right time, getting the right care. Same thing with the hospital beds. There are a lot of bed blockers. And there's alternate levels of care we can certainly seek, but you want to make sure it's that right person, that you're utilizing those resources effectively and appropriately. So, with all of that, we could see an implementation by the spring, by the time we go through all the regulatory components. And that's one of the reasons why we published early our minor ailments program. And we worked with the University of Waterloo to generate the content. And we're quite confident that the way we're approaching it is clinically effective, but also the best way to ensure we have optimal health outcomes for the patient.
For sure, I agree. And that is actually a very good point because one of the things, from my experience with COVID testing and when I was doing that research on it and just to identify what are some of the barriers, obviously time was the highest or the biggest barrier that was identified by our profession. And obviously, as we were talking about expanded scope of practice, we're always trying to see how does this fit into the time that a pharmacist spends, with the regular shift that they're working, that'd be the 12 hours or the 8 hours, depending on where they're working. what are some of the challenges or barriers, that exist at present amongst pharmacists and pharmacy professionals that, kind of prevent them to practice to their fullest potential? I know like the time is obviously one of them, but, just trying to figure out, from an advocacy side, like, where do you see what are some of the valid challenges and the barriers?
It's an interesting question. And as you sort of pull back the covers on this, it's not a simple answer or a simple solution that's going to be a panacea for the challenges and the complexity of implementing services, because we're still in this drug distribution model, right? And as we look at trying to implement a service model within that drug distribution, that's not an easy thing to do. So we have what is a transaction to a service, and they're very different workflows, overhead costs, labor requirements, et cetera. And so we need to account for that. And we need to also understand the diversity that exists within the pharmacy ecosystem, both in Ontario and nationally, because we have many different business models, be it an independent, clinical focused or co-located within a clinic pharmacy to big box corporate stores. So we need to understand what are the rate limiting steps and the barriers that are prohibiting the optimal implementation of services. And I think it really comes down to three main things if you had to distill it to a more simplified framework. And the first is we need to incentivize the appropriate behaviors. So compensation, both from a payer perspective, be it government or private, is important, but also making sure that there's incentives and motivating factors for the profession. We can't just simply ask people to do more with less. And what we've seen here is an erosion of wages. We have seen challenges in some cases with workplace conditions, not having the appropriate resources to support additional services. So if I'm expected to do the same number of services and dispensing activities that I was doing before, and now all of a sudden I've got 30 more to do, that could in a lot of ways create some challenges. So we need to make sure that we enable pharmacy technicians, as an example, to be able to do some of the tech type of models. I also think because we're at that crossroads of automation, innovation, and disruptors, and pharmacy has been somewhat slow to adopt some of these things. But I'm always reminded of a story from a keynote that I was part of years ago about Amazon, and how Amazon will never disrupt pharmacy because we have regulatory barriers, we have consumer behavior differences between here in the US and other countries. And I remember thinking to myself, we don't want to be the Blockbuster Video example where, having worked there as a student, it was thought that nobody will ever go to a machine basically to get your DVDs. And then from there, the internet and streaming was such a long journey that nobody thought would happen because you needed broadband internet. There were so many barriers. Yes. And look what happened. That model of having to go and get your service, in this case, a DVD movie or VHS, if you go far enough back, is obsolete, and they didn't adjust their business model. And I don't think it's a fair apples to apples comparison, but I do know that when you look at the model that we deliver today, what the pandemic has done for curbside and home delivery, and more acceptance of healthcare, of having virtual options, the fact that I can have a phone or virtual video consult with a trusted healthcare professional is being more readily accepted as a means of healthcare delivery. Pre-pandemic, I don't think that was the case. The bricks and mortar, that physical interaction, which is still going to be a need and required for certain services. But if I'm simply, giving you test results, there are cases to be made that I can still do majority of those consults virtually. That's going to free up the pharmacist. The practice of the future isn't going to be sitting in a bricks and mortar during your shift, but it's going to be going out to where the care needs to be. And that's going to require the automation. So it's going to require things like more mail order, central fill solutions, robotics, which we know is coming and we know can do the majority of at least chronic meds. And the personalized, customized services and the omni-channel around that, how I deliver it through apps and in-store experience, is where you're going to differentiate yourself in that relationship with the patient, which is really the currency that pharmacists have, is that touch points 14 times more than any other healthcare provider on an annual basis because of the relationship. So, that's not going to go away, but the service delivery will. And we're starting to slowly see that. And I think consumers are ready, patients are ready, and that's the future of healthcare, let alone in pharmacy. So that would be number two. We need to implement the automation and innovation to support service delivery, but we also need to support the profession with all of the tools to be able to implement it. Yes. And that can be everything from not just human resources, but best practices and making sure the working environment is conducive, whether it's the store configuration or any number of mechanisms that can be implemented, because our model is not set up for services. It's, really set up for that transaction. In most cases, although there are many pharmacies that are moving into a different configuration, the whole intake process is almost being flipped on its side. But I think, ultimately compensation, the operation side and support and work environment are going to be critical success factors.
I agree. I mean, you actually answered a lot of those questions in that one answer. So that, perfect. Kudos to you on that. But I think in the compensation piece, obviously, it always, hits to where it hurts the most, right? Where we have seen the declining wages and, just any thoughts on, how OPA plans to address that issue in particular? Because I know that, from my own conversations with my peers and colleagues, like that is one of the biggest concerns that we're seeing from a professional level. So, how does OPA plan to address that?
I think we're looking at it holistically in terms of what can we do to better support the pharmacy profession, from mental health, more mental health awareness and tools to help support the practice, addressing the burnout issues. And I think there is a correlation very directly to workplace conditions, ensuring that there's appropriate breaks, ensuring that compensation wages are at a reasonable level, and that there's hope. We need to provide people inspiration and hope that this is the profession they want to invest in and they can see the future of. It's not a simple answer. None of these questions are, unfortunately. It's obviously got a lot of tentacles to it, but I think supply and demand is a huge factor to that. So if you look at the GTA as an example, when there's a surplus of pharmacists, the wages go down. If you go outside of the GTA and certainly in more rural or remote areas, the wages go up, and it can be a $20 per hour difference in some cases. So, demand and where people want to work and how they want to work is really important. And I think we need to do another wage survey to better understand the data where we are in 2021 in comparative to the last one we did, which I think was in 2016 or 2017. But I think we have to ensure that, yes, having international graduates is very important. And at a time when we had a deficit of pharmacists, they turned the tap on. And now I'm not convinced with the number of pharmacy schools we have in the country and the number of graduates and IPGs that we have what we need in terms of the profession. So there needs to be a recalibration, which isn't to say we need one versus the other or less, but I do think we need to think about how many are graduating, how many jobs are feasibly available, because that is one of the factors that's leading to it. And I think, even the proliferation of pharmacies can be a good thing as we grow and we see more and more opportunities. But, and I think pharmacists, if you can, need to be also cognizant of where they work and negotiating and having skills to negotiate for themselves when it comes to asking for things, whether it's on a day-to-day operations perspective. Advocating for themselves is something that we want to arm the profession with when having discussions with an employer. And I don't think it's just a corporate versus independent. I think this is true across the spectrum of pharmacy. And we need to look at, ways we can empower pharmacists to have those conversations and really take control of their profession in a way that maybe has slipped over the last several years.
I agree. And as you said, I kind of give the same advice to, folks who ask me is make sure you negotiate and make sure you know what a fair market value is, and, make sure you are able to have that conversation with whoever you're planning to work with, because at least then you do not have any sour lemons to worry about at the end, right? And I think one of the things, so obviously compensation is one, and the other thing that I always constantly get is this is again from my own learning as well, trying to understand the whole advocacy piece and what kind of happens behind the closed doors, because To be honest, before I used to be a OPA member for a few years when I graduated, and then kind of fell off the boat just because, fees and all of that. And I was truly like, I think when you hear the grassroots conversation, some of the conversations are to the point of, oh, the association's not doing much, or we are not seeing, the worth of our membership value or anything like that. And you kind of get convinced when you're kind of in that flow and when you're in the company of, people who are having the same conversation, but you have to put yourself kind of step back and like reconfigure to see what you're seeing in front of you. And I think it's always good to understand, what happens in advocacy and how does advocacy actually take place to get a better understanding and an appreciation for all the work that all of you do at OP and all the other associations, because I think it's tremendous and backbreaking work, to be honest, and it's never easy because you're trying to do something for the future with not necessarily having all the right pieces of the puzzle in front of you.
Yeah, you raised a lot of excellent points and certainly salient to the last 18 months when you look at an organized effort, when you have a united front and clear asks to government how you can be successful. We're not done by any means, but I think you need to give people a vision for what it is that you stand for, from principles to the integrity of the organization, and not be afraid to admit when you don't get things right. And the ability to course correct is really important. That empathy piece is also critical in terms of understanding, and listening, a lot of listening about what are the challenges in the profession and how can the association really step up. And in a lot of ways, it's about managing, like advocacy is about influence, right? So your
Right.
currency is your influence, and that's, you get your influence from not only just your positions and asks to government, but also from your representation. The larger the representation, the more influence you're going to have, and the more ability you're going to have to unite around a common cause. This is never going to be an industry with a single voice, because from pharmaceutical manufacturing to wholesale to the profession to the business of pharmacy, it is very diverse. But that doesn't mean that we can't coalesce around a common set of asks. And, I hear a lot about pharmacists talk about how easy advocacy is. You can ask. I mean, people can ask for dispensing fee increases. They can ask for scope. Asking is the easy part. Getting the outcome is the hard part, and being strategic about it and understanding that you're one cog in the entire system. If you talk to doctors, you talk to nurses, they'll tell you the same thing. They're not getting everything they want. And I think it's all about prioritizing your asks, being disciplined in how you approach it. And the most critical part to advocacy isn't just the association going in, but is leading the narrative on social media. It's about getting the grassroots mobilized as a profession. So it's about giving the tools to our profession to advocate, not just during election time, but all the time, because you're advocating every touch point you have with a patient. And that patient's a voter. So getting them to understand that this is a valuable service, regardless of the party in power of the government of the day, they will advocate for you. And that public relations component is really what is going to drive that. So it's at a digital level, it's at a grassroots, boots on the ground level. And I consider public relations is very much like an Air Force, right? It provides that cover. The grassroots mobilized boots on the ground is your government relations efforts, which is developing the relationships with all parties in a nonpartisan way, but also with the government of the day, with the cabinet ministers, their political staffers on the political side. You need to have those strong relationships. And you also need to have the ministry officials relationships, and they all change. So you're always going through a cycle of education, orientation to each of the individuals who come into those roles, not just during every 4 years, but even in the cycle. So I think that's important, but also we can't be navel gazing, right? We have to have solutions to real problems. And it's not a partisan scenario. It's whatever government's in power is trying to solve problems. And there's always a crisis. And we're seeing obviously one that we've never experienced before with the pandemic, but you need to come to the table with concrete solutions. And you need to be able to turn that dial of pressure when needed. And that's where the media comes in, whether it's through social digital media like platforms of Twitter and LinkedIn and Facebook, et cetera, but also through traditional means, print, paper, and air. I think, whether it's TV or radio and so forth. So we've done a nice job with a limited budget of having a public relations campaign. We started with Ready for What's Next. So really pushing the angle of this is the pharmacy profession, building morale within the profession, building respect and awareness within the general population and within government. And I think the pandemic coming out of it is going to show that effort to drive awareness and the value of is going to lead to successes on the advocacy front, because you can't be one and done. That has to be a sustained effort. And, OPA and other organizations had 10 years, 12 years, 15 years of making asks before I started. So I'm not starting things from scratch, but we did take a different approach to our government relations, internally and externally, our relationship building, and it's an ongoing process. We'll continue to make those investments. We're here to defend, protect, and promote. And it's important for the profession to make an investment in themselves, because that's the association. We're only as strong as our members. And the work we do is all not-for-profit. It goes back into public relations campaigns. It goes into the resources internally to be able to have success. And that success is never short-term. It's always thinking long-term, and it takes time. As we've seen with this government, a government that has demonstrated support for the profession and pharmacy in general, we're still working on getting some of these things over the finish line, but we'll get there. And I think the more success we have will position us for the inevitable conversation about, the drug budgets, costs are going up, new government, what are we going to do? We want to avoid cuts at all costs, but we also have to be prepared for the fiscal realities of deficits and debts. We can't be ignorant to that with our head in the sand. So what are we going to do? Are we an investment or are we a cost? Can we get out of the drug budget, right? Can we start getting into the primary care budget, showing the cost savings, and that way we're not pigeonholed the way we are today. So those are all the things that strategically we're working on, but having that respect and the public support for everything we do will be invaluable for our efforts moving forward.
I agree. And that thank you so much for sharing those insights, because that really helped, for me, for sure, to understand the tremendous amount of work that goes behind the doors. And sometimes, we may not have the appreciation for everything that you are doing in the back doors, and that this was supposed to, help us all learn, kind of the amount of effort it takes for one piece of the puzzle to fit the right spot that we want it to fit into. And I think you had kind of spoken to about the election, and I think we are all very well aware that elections are coming up, in a very near, in a couple of weeks. And I just wanted to kind of get your insights in terms of how the elections will affect the future of pharmacy, and what can we expect?
Yeah, and as we look at the federal election, we're going to certainly take some of the tools that our partners like CPHA have developed and look at how do we customize that for what isn't that far off for the provincial election in June of 2022. But essentially, we want some key opinion leaders to go out and champion the cause and advance the narrative of why pharmacy is an important element of all parties and their platforms. We need to make sure that they understand what we bring to the table in terms of our ability to deliver patient care, our ability as a sector from an economic engine perspective. I mean, Ontario alone, we're in excess of $5 billion in economic output, 60,000 jobs. We have 5,700 pharmacies and over 22,000 pharmacy professionals. What an enormous part of the economy. And we need to underscore that, because that's important for any government. And it's about a nonpartisan position that can work with any party and ensure that we have an investment in our supply chain, which I think coming out of the pandemic at a federal level is critical. Right now, only one party out of the three even mentions about the pharmaceutical supply chain and need for domestic capacity. When we look at drug shortages or dependency on other countries when we're in a global pandemic, and that was true of PPE as it is for the manufacturing of drugs. But we've seen an exodus, which puts us in a vulnerable state. So we have to get away from just looking at cost, but looking at other value drivers. And that's going to require investment in ensuring that we have the right amount of domestic capacity moving forward. So things like the PMPRB, drug pricing, how does that work? Educating pharmacists and the public about, it's not just about paying for drugs. It's about making sure that we're still a tier 1 country, so you have access to innovative medicines. Absolutely, we need to generate value, and generics are a huge part of that. And it's what I see this as an ecosystem that is dependent on each other. The generics, you reinvest the money and savings from there into innovative medicines and so forth. And true of the biologics and biosimilars. Rather than competing or having that division amongst it, it's seen as a an important part of each other to support. And I think you're seeing more of that cooperation. And PMPRB has massive changes on the horizon that could impact the availability of drugs. It could accelerate drug shortages, less choice and options for Canadians. And I think when that happens, it's very hard to pull back because, these is a global supply chain. And that certainly poses risks and vulnerabilities for Canadians. The other component is pharmacare. So, there's a couple platforms that mention national pharmacare. I think actually all three of the major parties have some mention of what their vision for national pharmacare is. And pharmacare means very different things to different people. Are we talking about a first dollar fully public system? Are we talking about a fill the gaps, if you will, system to make sure no one's left behind, focus on rare diseases, things of that nature? And I think you're starting to see more Canadians with the pandemic focus on, well, it's not right that somebody shouldn't access their drugs because they can't afford to. Maybe they lost their job or the deductibles, co-pays are too high. So we've always been very supportive of a mixed system that ensures that we have a catastrophic plan that takes care of Canadians. We remove any of the financial barriers to accessing medicines. We also protect choice of the plans that many Canadians enjoy, and it's fiscally responsible. So I think, two of the three parties certainly seem to support that approach, which we're encouraged by. There is already the Canadian Drug Agency, which is yet to be seen exactly what that's going to do in the Pan-Canadian Pricing Alliance and working with other agencies, but lots of discussions there. PEI and the federal government did a deal already where there's investments prior to the election in filling the gaps, which could be a model to work with within the federation of all the different public-private splits, because Ontario has a significant private employer plan base, but other provinces don't. Quebec already has a pharmacare program, so I don't think a cookie cutter approach or a single solution is going to work. Like everything in Canada, it's very diverse. So I think we need to ensure that the model is flexible, can work with the provinces regardless of the political affiliation or ideology. But at the end, as Canadians, we value our public system. It's not a single payer system, and it's not always universal, and it can always be improved. And we want to be, as pharmacists, at the forefront of shaping that in a way that's not detrimental, but actually increasing and improving health outcomes.
For sure. And I mean, obviously, this is an important question, even I guess, for the profession and for our patients to be asking our candidates, right, as we are deciding who to vote for, because it has a direct implication on, whatever healthcare you're going to be seeking or currently seeking right now that you're requiring. And I think I just as I'm wrapping up, just a couple more questions for you. And this was, again, one of them was to highlight the role that OPA has, especially with your leadership, in creating the diversity task force at OPA. And to my knowledge, you were one of the first leaders to, kind of have this open dialogue and discussion around inclusivity within the profession itself. And, very impressed with the work. I had the opportunity to sit on the first inaugural task force committee, and, I would love to just hear of some of the achievements that have come out of that task force.
Yeah, what you're seeing more and more throughout businesses is this idea of having ESG, which is the environment, societal impact, your corporate responsibility, social responsibility, and governance, good governance practices in everything you do. So it's not a one and done scenario, but it's a sustained effort to make sure that your employees, all of the outputs of the organization have that lens of the equity and diversity and inclusivity, and also that all your committees and board reflect that. And the composition of the board and staff are important. As leaders, you want to make sure you have a diverse, not just in culture and ethnicity, but also in thinking. You don't want the same thinking in everyone. And I think that's really important at a board and strategic level. We want to have the right skill sets around the board, and we want to reflect the profession we serve, which we know is very diverse, both from gender and ethnicity perspective. So the effort really is for OPA to be committed to continuing to having dialogue with all people, understanding new barriers to existing barriers, because we have a lot of work to do as a society, as we have seen, and also as an organization. And specifically, we want to make sure that we have concrete programs that deliver on the commitment of being inclusive. And that is everything from the stock images we use to the education we produce, to working with the schools of pharmacy and ensuring that their curriculum are reflective and it's not just a 1 hour part of the overall program. I think of some of the discussions we had at our EDI or our diversity task force last summer about, even testing skin products, where, it's predominantly white people that are tested. And one thing that I learned was even not having that unconscious bias, right? Not even understanding that things as simple as Band-Aids have a cultural bias, because for a long time they were only for Caucasian people, right? And having diverse kids that are mixed race, I didn't even think about Band-Aids, right? So it's creating that awareness, it's having the conversations, and it's not being afraid to tackle some of the uncomfortable conversations. That we're all coming at this with the right intentions, but we do have our unconscious biases that we need to address. So I think those are really critical to continue to have. And also a mentorship program. When I think about trying to encourage people to run at the level of an OPA board or to be involved in committees at the association, we want to encourage people to run. We want it to be an environment that fosters creative thought and get away from groupthink, and people feel comfortable and confident to be part of the association. Our senior leadership team has changed over the years. We have, two females, 2 males. We have, cultural diversity as well in the 4 team members that we have. I am proud of that. I'm proud of the reflection of our board now that does represent more cultural diversity. And that's something that we'll continue to work on to make sure that we follow through in our commitment. It's such an important topic. And now I see a direct correlation to mental health as well. Are there limitations and barriers based on race, as an example, to mental health tools and supports in different work settings as well? We know burnout is a huge part of the profession, and it's only getting worse. So we need to step up in the same way we did on diversity, inclusivity, and equity, because in my view, it's a right to have access to mental health services. We have to continue to destigmatize mental health and be leaders in providing that. So that's going to be our specific emphasis over the next 12 months that's tied into it. But we've incorporated ESG into everything we do.
That's fantastic. And thank you again, for starting this task force, because I really do, see very promising actions coming out of it, and, look forward to creating an even more inclusive pharmacy profession where everyone feels like they have a safe space where they can have their voice heard. And I guess just to wrap this up, how do you describe the future of pharmacy in the next 5 years?
Well, I'm reminded of another story. Happens to be about Amazon, but it was one of the keynotes that I was referencing earlier. That I'm not even sure I told the story because we got off to another great area as we were chatting. But it's about this farm equipment company in northern Manitoba. I've told the story a few times, but I think it's worth telling again. So it was family owned for generations, and they would deliver heavy equipment to tractors and things that were mission critical. Because if your tractor is down for more than 5 days, that's, that means your whole business is paralyzed. So a small business, and it was largely based on reputation, relationships, and the family's connections. But if Amazon can disrupt that business, they'll disrupt anything. So, what they did was they came in with a service that paired it with like an Uber mechanic. So not only did they deliver the part in less than 48 hours, and that was whether it was a business day or weekend, they could pair it with the mechanic to fix the tractor. So your downtime was 2 to 3 days versus sometimes 7 to 10 days. So if you think about the ROI, but if they're targeting businesses like that, no business is immune to disruption. And it doesn't have to be just Amazon. There's tons of disruptors out there, innovative ways of delivering services. So when someone asks me what the future of pharmacy is, well, you don't want it to be that tractor company. You don't want it to be that blockbuster video. You want to make sure that you're making investments to deliver the care that people want, because it's going to be empowering the patient. So access to virtual care, having more automation and choice. So yes, bricks and mortar will always be there. Pharmacies will be accessible, and that healthcare advice, whether it's delivered virtually or in in store will always be a central part, but you can deliver it in many different ways. And we see that with the Maple app and other virtual tools, MedMe, MedAssist, that offer that technology to enable it. But all of this, regardless of the technology platform you use, what we need to make sure is we preserve that relationship and the access between a healthcare provider like a pharmacist and a patient, because everything will revolve around there. And I've seen different stores, even in the US, where they've created a wellness center and the whole pharmacy is in the middle of the store, not at the back or side. There's no counter, right? Like literally everything is delivered to the person, but the person and the healthcare provider are met at the beginning. And the intake is very different. So, I think that's one model. There are many models of care, and not always being tied to the bricks and mortar, I think will give us even more value and access to doing so many different things. Let's unlock the value of the expertise, support it through the profession. And I think that ultimately is going to drive whatever future technology exists. We know that people are using their phones more, and we have to catch up to that service delivery without compromising the quality of the outcome. And I think that's going to be really the key.
I agree. I think innovation and just being open to change is really what will help us, kind of, I guess, continue our legacy forward and, adapt to the changing times, because obviously the expectations of our patients are changing as new generations are coming in, and they're requiring different things, different ways, delivered in a different manner, right? So just making sure that we're open. And thank you so much for those. Well, even,
one last thing on that, because it's a great point about open to change. When I first went out talking about asymptomatic testing for COVID, yes, there was quite a bit of opposition. There was, like you would see in an adoption curve, there was about 10% really early adopters and innovators, and then the curve goes as people become more accepting of and comfortable with the protocols in place. But now, in the last call for participants for the unvaccinated teachers to go into pharmacies for testing in Ontario, we have over 1,200 pharmacies putting their hand up, and it's growing because people are more comfortable with the health and safety measures they put in their stores, whether it's the barriers, the PPE, following IPAC protocols. And they know that, by doing vaccinations and even asymptomatic testing that's been in place, you are at some risk. So we're looking at everything from symptomatic to asymptomatic testing, rapid antigen to PCR, mobile on site to curbside to drop off to in-store. So we've got that area covered, and we'll continue, I think, to see more and more pharmacies put their hand up. And that's because progress at the beginning is tough. Doing things outside your comfort zone is not easy. And there's often if you listen to a lot of the podcasts about leadership and, what are the traits of good leaders? Well, making people uncomfortable with an idea because it's outside their comfort zone is probably the hallmark of this a good idea, right? Because that's challenging status quo and it's preparing you for the future. And nothing is immune to threats and risks, but certainly I think we've demonstrated that it can work even when there's some initial opposition. And there will always be a cohort of people that will say, well, I'm not going to do this. I'm comfortable doing what I'm doing. And as long as it's voluntary, as long as there's an option, then I think we should forge ahead. Otherwise, we will be left behind, and we don't want that.
I agree. And I recall the times as we were quite divisive in terms of, the views we held as a profession. So, great story. And that's a perfect way of actually ending this segment, because I think it really is, the moral is, let's be open to change, let's be innovative, and let's challenge some of our barriers just so that we can break them and forge the way ahead. Thank you so much, Justin, for your time and those valuable insights, because I learned quite a lot from this conversation, and I hope that I'm sure the listeners will also learn. And I also wanted to take this opportunity to highlight that you also have a podcast running titled Pharmacists Matter. So please be sure to check that out. We'll link it below, and so that you would have that. And I'm sure Justin, just the way he has shared some valuable insights here, we'll learn a lot more through that as well. So you have one new follower in me there, Justin.
Well, it's all about being together and supporting each other. And, I think it's great what you're doing, and look forward to your future podcasts as well.
Thank you very much. Well, with that, I'm just going to wrap this up, and thank you again for your time, and we'll see you next time.